So we'll pick up where we left off before. So we're looking at ankylosing spondylitis. So Sahar, why don't you take this case?
When you are male severe trauma, that there are multiple syndesmophyte formation with likely breakage in the syndesmophyte of alveolar flight.
So if you look here, you can see that there's a lucency right along here, a break in the cortex. We can see a very nice bamboo spine with syndesmophytes at all levels. And if we then go to the CT scan, what do you see here?
So there is fracture of the left critical and it's going to vertebral body on the left side.
Here we can see continuing
Fracture of the vertebral body.
So this is one of the feared complications of ankylosing spondylitis. We have a rigid spine that is very susceptible to trauma, especially in older individuals who end up having osteoporosis. And we can see fusion of the facet joints as well, which is typical of late poorly treated ankylosing spondylitis. Shiv, what do you think of this case?
A history of ankylosing spondylitis with acute onset back pain. So it looks like, again, I see sort of that dagger sign. The spinous processes look like they're fused, and it looks like there's irregularity maybe of the mid-lumbar spine. There could be a fracture there, right in through there, yep.
Okay, CT shows.
Okay, so here it looks like there's a fracture of the mid-lumbar spine and the posterior elements, and there's some desmophytes and all the sort of classic findings in ankylosing spondylitis. Mm-hmm.
So 66-year-old female, ankylosing spondylitis. There's some leftward curvature of the thoracolumbar spine, and there's some, I guess maybe some enthesophytes.
Okay, what do you think this is?
Syndesmophytes. So as a meningocele.
Here we can see in the sagittal images. And here's the that axial image right through that area where we saw that. And a lot of people call these dural ectasias, which are pretty common in ankylosing spondylitis. Here we can see some facet disease and inflammatory changes, the shiny corners that we talked about before, zygoapophyseal arthritis. And there we can see further examples of inflammatory disease and these characteristic locations which are common with ankylosing spondylitis. There we can see the anterior shiny corners we saw before, and then all this posterior inflammatory disease. And then here we can see some enthesitis back here involving the the excuse me, the spinous processes and the ligament there. Okay, let's see. Sam, what do you think of this one?
Really black. Well, first of all, the musculature is like all gone.
What do you think that's due to?
Just disuse because the patient's not bending. I mean, if this is chronic ankylosing spondylitis, like the other cases, the patient's probably not bending the back much.
So
yeah.
Not much for the muscles to do.
Right. Yeah. So it looks like a lot of signal loss in the posterior elements here, spinous process, and at the facet. And that looks like a hemangioma there, actually. But okay.
There are clean films at that level. We can see that there's a lot of calcification of the discs and the fusion here. And we can see a lot of what look like erosive changes here posteriorly on the plain films. This is what this EMR scan looks like. And these are called laminar erosions, which is similar to the dural ectasia, which you can clearly the bamboo spine here, which is rigid. Okay. So, Har, what do you think of this case?
Okay, so we have
Patient just his back pain.
okay, full body 1 scan shows increased uptake of the lumbar spine. And how many cyclists? Okay, so there is some abnormal T1 signal involving the L4, and also maybe there are some shiny corners of the L5 in the last image. Yeah, we have some like loss of viscous space. What's that? Hemangioma.
I'm sorry, what?
Hemangioma?
Yeah, well, it's not really a hemangioma. We see that it's at multiple levels here. It's very hot on the bone scan. We have here these thickened trabecula, and it's not really a focal lesion. It's really involving 3, 4, and 5 with thickened trabecula, a little bit of diffuse loss of the fat signal here at 4. The vertebral bodies really aren't enlarged here, but this is kind of a characteristic MR appearance where you have all these thickened trabecula and these voids of trabecula around it. So the trabecula is abnormal. You've got a little bit of thickened cortex here. And this is pretty characteristic of Paget's disease. It's not, but I think it's reasonable to say hemangioma, but hemangiomas usually aren't multiple levels like this. They usually aren't quite this hot on the bone. If you also notice, this also goes back into the posterior element of typical hemangiomas that we see. Okay, Shiv?
Okay, 49-year-old woman, intermittent low back pain for 20 years, severe back pain, intermittent left hip pain, guess the SED rate is high. Okay, so looks like a CT and some plain films, and it looks like there's sclerosis of a couple of thoracic and lower lumbar vertebral bodies. Maybe some, yeah, mostly sclerosis. And the MR shows hypointense signal sort of in those areas of sclerosis. And similarly here.
So they kind of have multiple areas here. These kind of shiny corners, and it's a little bit atypical at the lower thoracic level to have
Right.
anteriorly, more posteriorly, when it's degenerative. And we have these areas where it looks relatively normal, and then thickened with sclerotic changes. And then on the plain films, we can see the end plates are very irregular through here. So it can be inflammatory,
Infection or inflammatory.
right? And then the patient also had some anterior chest wall pain, which is very characteristic of particular.
Yes, this is sternoclavicular sclerosis. And whenever I see that, I think of SERMO and SAPHO, which could be this case. Yeah, SAPHO.
SAPHO. Synovitis, acne, pustulosis, hyperostosis, and osteitis. And it often presents in children as kind of a migratory, clinically focal osteomyelitis.
Yeah.
And it's inflammatory. No one's really been able to figure out, to my knowledge, what's inducing the inflammatory processes. So it can be extremely frustrating with this. But the anterior chest wall is really quite common. It's much more common in thoracic than the lumbar than the cervical spine. It's in about 33% of cases in adults. And that's a SAPHO syndrome. So that's kind of an overview of inflammatory disease. So why don't we stop here and people can log back in and we'll continue looking at trauma. Okay?